So getting back to the numbers, Gary, why do you think Tulare County's per capita number is so much higher than, say, Fresno?
Right. Yeah. It's an excellent question because I think it's a perplexing question. I think I was reading the Fresno Bee yesterday or the day before, and their population for the Tulare County is almost 1 million people. And then if you compare that to Tulare County, where maybe we're 450 to 500,000, we're half the size of Fresno County. But they've reported that they've only had 384 positive cases compared to our 441, that they've only had 7 deaths compared to our 25, and that they've had 132 people recover compared to our 66. So it just wouldn't, doesn't really make sense, because I have a hard time believing that the residents of Fresno County were, exercising better shelter in home and social distancing and washing their hands. I think, the Central Valley community, very similar to our community, so it's hard. And they have, they have more dense population too. So again, it doesn't really make sense. 2 things I would point to. Number one, I think Tulare County and Cuya Delta in particular had the ability to test sooner and more comprehensively. So I think we've actually done a lot more testing than they have. I mentioned, Cuya Delta already having collected almost 3,000 tests, and we absolutely were the first to be able to do in-hospital testing on the BD Max and Abbott platforms before any Fresno hospital had that capability. So I think that's part of the answer. But I really think that the most predominant reason, really the single distinguishing factor, is the outbreak at Redwood Springs Nursing Home. So I've not read of a single nursing home in Fresno County that had an outbreak. But we've actually had 2 now, the Redwood Springs and the Lindsay Gardens. Redwood Springs alone has accounted for 174 positive cases out of, again, 441 county-wide, 174 just at that nursing home alone. 111 of them residents, 55 of them staff, and 8 of them most likely visitors. Lindsay Gardens had 43 total positive cases now. They started out with just 1 or 2, and just in such a short period of time. Again, you have a very confined space. Oftentimes patients are sharing rooms, and they have minimal staff going from room to room. And that's the outbreak among nursing homes. Again, I'm not singling out the 2 here because it's really impacted, it's been impactful nationwide. I was just listening to a report this morning from the administrator of a nursing home in New York that was hit incredibly hard. There have been almost 4,000 deaths nationwide from nursing homes. But, I've mentioned before that Cuya Delta, we own and operate a 54-bed skilled nursing facility over on Court Street. It's definitely a higher level of care than a nursing home, but they tend to be residents, long-term residents, and they have the same risk factors. But that was one of the very first places that we shut it down, locked it down, immediately, implemented the highest precautions of sanitization and no visitors and so forth. And I think that had a profound effect. And perhaps that's what Fresno County did as well. If you were to back out the nursing home outbreaks, Tulare County would have only had 224 positive cases. So that would be 160 less than Fresno County. And now you go, well, maybe that starts making a little bit more sense. You're doing more testing, and we had the nursing outbreaks and they didn't. So we still had slightly higher deaths. We would have 10 compared to their 7. But also if you look at the statewide health conditions, unfortunately Tulare County ranks in some of the worst in health conditions and health poverty, and so just a more vulnerable population.
Right. Okay, thank you for that. So let's move on to testing. So one of our community engagement members went by the Floral Street testing site last Friday, and they sat there just to watch and see what happened. So they did not see one car come through to be tested. So they wanted to know if that was because it's too expensive to be tested, or is Coweta Delta only taking referrals?
I would say that person found that sweet, quiet spot that I'm sure the staff were savoring at the time, because we still are seeing about 60 to 80 patients a day. In fact, as I was walking out of my office last night, I ran into two nurses that were coming across from the Floral Street, and they had just finished their shift, and I asked them how did it go today, and the two of them had 65 specimens that they collected yesterday. So it does continue to be very busy. We do only see patients that have a scheduled appointment with us. And those patients are either sent over by our employee health department. So if we have an employee or a resident or a physician that we want a specimen collected so we can test, employee health will schedule that appointment and they'll go across the street there. Or if a community member has called in to the county and meets the symptoms, the criteria, then the county will issue the person under investigation the PUI number, and they will contact us and schedule an appointment, and that person will come through. Or if a private physician wants to send a patient, they can order a specimen collection and a test. The patient generally has to be symptomatic for us to do it, or the physician has to be, very suspicious that there's something I need you to look at. I need to rule this out. So those are the ways in which you come into that specimen collection site.
And expense has nothing to do with it.
No, although as you'd expect, Medicare, the state through Medi-Cal, all the commercial insurance plans have all put in fee schedules to reimburse providers. It's not something we establish. We don't establish the reimbursement rate. It's not a negotiated. The payers have come out, this is what we'll pay for the specimen collection, this is what we'll pay for the testing piece of it. So we do collect that information from patients, and where they enrolled in one of those programs, we do bill and collect for those. But we also see the uninsured, and so if somebody does not have coverage, then we do it for free.
Mm-hmm.